Hey, Chuck.
All right, I knew if I typed the magic words, you would appear.
Sorry, I'm always running pretty tight to the wind.
Yeah, no problem. All right, well, we will go ahead and get started. Welcome, everybody, once again. I am Chuck Carney, Director of Media Relations for Indiana University, and welcome to our weekly online news conference with the city, the county, IU, and IU Health. And as always, we'll have Bloomington Mayor John Hamilton here, along with Monroe County Commissioner Julie Thomas, IU Health South Central Regional President Brian Shockney, Monroe County Health Department Administrator Penny Caudle, Monroe County Emergency Management Director Allison Moore, and IU Assistant Vice President for Strategic Partnerships, Kirk White. We will, as always, take your questions in the chat from media here on Zoom, and we will get to those as soon as everybody begins with some opening statements. We will start with Mayor Hamilton.
Thanks very much, and thanks everybody for being here. I'll just briefly update on a few things. We did open playgrounds, fitness stations, and basketball courts a week ago today. Our operations staff sanitized 24 playgrounds and fitness stations in new record time last Friday. I want to let people know public restrooms are also open in 3 of our parks, Olcott, Bryan Park, and Lower Cascades Parks. They've been open since last Monday, 13 hours a day with sanitization happening daily with staff on site. We hope to open a couple other parks, restrooms in stage 5 where we don't have, unfortunately, the staffing to do the regular sanitizing. That'll be at Butler Park and Building and Trades. Splash Pad did not open today at the Switchyard Park. They're still doing some final checks and maintenance and working with the health department to make sure we've got everything buttoned down there on these hot days. We're doing that as quickly as we can, and we'll look forward to the Splash Pad being the city's best wetting dousing option that we got since our pools can't be opened. Letting people know also that effective Monday, we will take what was a very strongly encouraged and stressed mask wearing rule for all of our employees and make it a mandatory rule. We've decided, as the data continue to come in and as we've looked at around the city what we should do, we have decided to make mask wearing mandatory for all city employees anytime they're within 6 feet of each other or the public. So that'll be effective Monday. We're providing those masks and face coverings to folks. And let me just close. I thank so much all the collaboration that we have in dealing with the COVID epidemic as we've moved to stage 4 with some tailoring locally. I know I do want to express, it's only in a few short weeks that we'll be expecting to have many, many thousands, tens of thousands students arriving from all around the country. And that really does pose a risk of resurgence and concern. And we're talking about that. And in this public setting, I just want to let people know we are really exploring how best to manage that. And I, from my perspective, really think about it from a kind of a simple cost benefit analysis, with the cost being, if we do have a resurgence with such a dramatic influx of people from all around the country and mixing together, if we do have a resurgence, the cost of that could be very high, not only for the direct health costs, which of course we worry about most, but also if it would affect the university itself and its ability to continue or dramatically change what it would do, make us go backwards. So we're really thinking, and I'm encouraging that we think about what are some of the benefits that we could do that wouldn't be hard. For example, looking at the large social gatherings and thinking about where the greatest risk is, which is really indoor, large numbers, not physically distanced over a long period of time, where the risk of a super spreader kind of episode could happen. So we're going to be continuing to look at that, and I'm going to encourage that, as well as more mask using and figuring out how we can encourage that. But right now, the data still look good. We just know we've got kind of the weather forecaster telling us this front is coming in. So we really need to plan on doing that and be happy to talk about it more. But let me close there and pass it on to the next. Thank you, Chuck.
Okay, thank you, Mayor Hamilton. We'll go next to Julie Thomas.
Great, thank you so much, Chuck, and thanks everyone for being here. Happy Juneteenth. I just wanted to give a few updates on some things that we're doing in the county. The buildings that were not open to the public are now open to the public, but by appointment only. So please be sure to contact the department that you wish to make an appointment with. We are providing masks for visitors, and our employees have been wearing their masks indoors. Our outdoor workers who are distancing are not required to do so. And we have also restarted our commissions and boards and their meetings on Zoom. So if you're interested in seeing one of those meetings, or you want to attend in any way, go to co.monroe.im.us and you will see the calendar at the bottom of the page, and all of the meetings are listed with the links included. We do want to remind everyone that parks are open except for the splash pad. The small playground near the soccer field at Karst is not open either. Some restrooms are open, drinking fountains are not. They're closed, so please bring refreshments, especially on a hot day like today. To date, we have granted over $270,000 to 28 businesses in the county who are working in some capacity related to tourism outside the city of Bloomington. And the window of opportunity is closing on us because if the governor's emergency order lapses, as we anticipate on July 3rd, that will end our ability to grant money. So please, if you have not applied, please do so as soon as possible. Again, co.monroe.im.us. A big thank you to everyone who is showing your care and concern and respect for other members of the community by wearing your face coverings. So please keep up the good work, because that allows us to keep moving forward and keep our economy going. So thanks everyone, and wait for questions.
Okay, next we'll go to Brian Shockney.
Thank you, Chuck, and thank you everyone for being here today. Just a couple things. As the mayor mentioned, we are doing well, but we do need to be very vigilant and as Commissioner Thomas said as well, wearing our face coverings. It's important that we get back to our normal business as well as continuing to care for COVID patients, and we do that. I've been saying the last couple weeks that June 15th was the magical date we wanted to get operations fully back, and we are almost there. With a few exceptions, we are seeing our full complement of patients in our sites, and so we're feeling good about that. What we haven't gotten to yet is catching up from where we were before. So we are at a full capacity to where we were prior to COVID, but now we've got a plan to catch up. So we'll be extending hours, we'll be extending our surgical hours, extending our clinic hours, extending other imaging in other areas so that we can make sure that patients who need the care receive the care. And I will say that in any healthcare facility, whether it's Monroe Hospital, it's our hospital, it's providers' offices, dentists' offices, you are very safe in healthcare providers because they're taking the precautions very seriously and much safer than you are in any community building or organization where you shop or play. So please keep that in mind as well, that we are a safe place. With that in mind, though, we are still continuing to do a fair amount of virtual visits and virtual care. And so we're continuing that forward, and we're not going to decrease that access in any way. Actually, we're going to be looking to ensure that we're continuing that access at its current level and engaging that at a higher level going forward. We do just want to say in closing, making sure that we are doing all the things about wearing masks, social distancing, limited waiting room times, something that we're doing, and then continually disinfecting, washing hands, doing the things that are important. As been mentioned before, and we need to just keep saying it, as the governor's order releases here coming up on this holiday, we need to be very diligent and not see it as an end. It is not an end, it is a continuation of diligence for our community and to protect our families and to protect each other because it does have consequences, as the mayor and Commissioner Thomas were saying, if we don't do that. So thank you for all that you're doing. Thank you, media, for continuing to cover this in a way that promotes safety for our community. And we ask that you continue to do that ongoing. Thank you.
Okay, thank you, Brian. Next to Penny Caudle.
Good afternoon. First, I will just start with the health department. As Commissioner Thomas mentioned earlier, is open by appointments. Our field staff have been meeting people in the field when they've needed to, for instance, with septic installations and those kinds of things where they can provide those services and maintain social distance. Oftentimes our inspectors are not even with someone when they're out there. For the most part, our appointments are right now focused on catching up on paternity affidavits and amendments to birth records because those were things that we had to really put on hold. And most everything else we can handle, whether it's via Zoom or a phone call or something like that. So those birth-related items have been what we've most had to put on hold. So we're scheduling those, and that seems to be going very well for us. So we thank everybody for their patience as we kind of resume that new normal of operations. I will remind everybody, you've heard me talk about this week after week now, but the Monroe County Community Organizations Active in Disasters, the COAD, has been launching a face covering campaign, Wear It B-Town, Wear It MoCo. And next week, they will be launching kind of a challenge portion of it. And each week, a different group or entity will be asked to kind of post them and challenge others in their field to post a picture on social media with their face covering on. And we're going to start, I believe, with government. So we're excited to get county government and city government, all elected officials involved in that, just really to bring some encouragement and normalization, if you will, that I know feels kind of weird to say, but we do need to continue to become more comfortable wearing a face covering when we're in public and we can't maintain that physical distance of 6 feet. The more information we get, the more that there are people out there who are asymptomatic and they may or may not develop symptoms as time goes for them, but they're able to spread the infection and they don't know it. So we need to wear those face coverings so that we're not spreading it, and we need to maintain that physical distance so that we're reducing that chance of spread as well. In terms of testing, the Optum site is up. It's very busy. They have been full most days now. And some of that, I'm sure, has to do with the fact that you no longer have to have symptoms or be in a high-risk category to get tested. If you wish to get tested, you just need to register. You do need to be an Indiana resident or you need to work in Indiana, but that's it. So register, make an appointment, and you can go to that site. The website to register is lhi.care/COVID testing. And you can also go to the state's dashboard website, and there's a testing page, and it lists all the different sites that you can go to, not just in Monroe County, but across the state. So if you have family or friends who are in other locations, or if you have difficult time finding a site and a time that works for you, maybe you can go to a neighboring county for that test. And we are seeing that happen. Certainly people are going to a location that's convenient to them, whether that's in their own county or not. So as testing opportunities increase, and they are increasing, that means we are really casting a wider net. And the wider that net, the greater the opportunity for us to find and identify cases of COVID-19. So we've talked about this before, we do expect cases to go up. That should not be a surprise to anybody, but we will also be watching in terms of the number of tests that are done and comparing those positives to the negatives. So we continue to see new cases in our county, but we are also watching the percentage of positives out of those tests. And that right now is remaining low, 3.6%, I think it is today. So that's encouraging. We can also look at the rate per 10,000 people. So there are various ways to look at the data. And right now that's encouraging, even though we may see an increase in cases. So do understand as well that as cases are identified, that an investigation is done, that person is interviewed so that we can identify close contacts, and those individuals can then be referred for testing if that's appropriate. They can be advised on what they need to do in terms of quarantine, how long to quarantine, and those kinds of things. So that is going, and that is done primarily by the state health department. You hear people talk about the contact tracers, and that's what their job is. Our local nurses are involved in that, to the extent if somebody isn't able, we can't locate them, or they need some additional help, then our local public health nurses can help with that. We're also looking for sort of the commonalities that may be happening when we see multiple cases. So were people saying that they were all at a particular gathering? Did they attend a large gathering or something of that nature, where we may be able to tell other people who were at that gathering that they need to monitor for symptoms? The state did report this past week that they added 3,000 to 5,000 tests from an independent lab, and they were just recently added. So kind of a change in the numbers this week from that, and I believe that those are all now entered and updated. We are working, as I said, with the state to look at commonalities and what's going on with increased numbers. Just want to make sure that if we need to be making some extra special efforts, that we're aware of that so that we can make that happen. We are seeing right now that it seems like many cases that are positive at the time of the test, people are asymptomatic, and that supports everything that you've already heard, that we know that people may spread this infection unknowingly. It's why socially distance, that physical distance, when I say social distancing, we're really talking about that physical distance for a period of time. So eliminating being around people closely without wearing face covering. If we can't maintain that 6-foot distance, we need to really be wearing a face covering so that we're not sharing those germs with, or whatever the germ may be. We could have a common cold and be spreading that. So a face covering will help with that too. The Fairbanks study has completed phase 2, and the preliminary data is relatively similar to phase 1, and 43% of the people who tested positive did not have symptoms. In phase 1, it was 45%. So again, drives home that what we've been doing is the right thing, wearing those face coverings and distancing. And also keep in mind that as we age, the older we are, the more underlying health conditions we have, the greater risk we have for death. And again, that's why I wear my face covering for other people. I'm not wearing mine for me. I'm wearing it for those around me. We are, and then on another note, we are receiving plans for various sports leagues as required. So thank you to those leagues for working on your plans so that you can hold those events safely, and that we have that information in case there are cases that come up related to that. We'll be able to do that assessment and respond quickly. We're also working with schools and universities, which are busy planning for school reopening, and it is an overwhelming task. I continue to be just amazed at how awesome our schools are at figuring out how they can provide education services. And they provide so many different services to our youth, and we just are here to provide guidance and direction and be a resource for them. The local health department is not intended to approve their plans, but to be a partner in that planning process. So we're happy to be doing that. The Indiana State Department of Health and the Department of Education is continuing to work together and developing more guidance as we move forward. The other thing that I would say, and we'll just kind of end with, is really a thank you to everybody who's taking things seriously, who's taking proactive steps to reduce the spread of COVID-19 in our community, but also maintaining their personal relationships and the caring for those around them. Thank you for cleaning, for washing hands, for testing, for staying home if you're sick, all of those things that we need people to do. And we thank you for respecting our local businesses, wearing a face covering as you're requested or required to do, and supporting our local businesses. Thank you all to the local businesses for following the requirements and protecting your staff and your patrons. Thank you all very much.
Okay, thank you, Penny. We'll next go to Allison Moore.
Thank you, Chuck, and good afternoon. I wanted to follow up the last couple Friday press calls. I have been announcing that we have a blood drive scheduled. It is coming up June 23rd, and we have every spot that is available for that particular blood drive filled. So I wanted to start with thanking the community for getting those spots filled. We have 50 individuals that have been willing to step up and make that donation for our community. I love how this community comes together in times of need for things such as this. And due to that, we are excited to announce that we are going to have 2 additional blood drives that the Monroe County government is going to support and get scheduled. So that information will be released, the marketing materials will be released next week and will be on our website. But it is actually already available for you to go on and get scheduled for those 2 additional blood drives. They are going to be both at the Monroe County Convention Center, just as our first blood drive was scheduled for, and they are both going to be the 10 to 3 time frame, just as the first. We are also looking at one of them to be extended into the evening because we do have some people that cannot make that donation during the daytime. So we are looking to see if that's a possibility. But at this time, they're both scheduled from 10 to 3 at the Monroe County Convention Center, and they are scheduled for June 30th and then again on July 17th. And so again, as soon as that information becomes available for us, we will put that on the county website. But if you want to grab and snatch up one of those sites, you can go to the redcross.org website and register through our a Bloomington zip code, and then that blood drive will pop up. And once that material is available, we put on there, we'll have step-by-step directions on how to do that as well. I'm happy to have a few more of those scheduled. They do anticipate the shortage to remain, as blood does expire every 42 days. So we're kind of excited that we will have that additional blood drive in July, and then 2 right here to help with such our dire need. I also want to take this time to remind individuals in the public that we have an Everbridge Monroe County alert system where we send out our updated health orders. We also send out weather alerts and various things for our general public. And you can also sign up for that. It's a free service. You can sign up to get those alerts via a text message, a home phone call, and or an email. And you have those 3 options. You can have those messages come all 3 ways or one individual choice. And you can sign up for those on our county website on the homepage, co.monroe.in.us. I also wanted to let everyone know that we too are working closely with all of our schools. And there is so much things that are going into the things that they anticipate needing come the return of our students back into our schools. And so we are working with the Indiana Department of Homeland Security and of course the Indiana Board of Education to get the supplies that they need and to secure that all of our schools have everything that they need for our students. And so we're working diligently to collaborate with them to get those needs. Thank you so much. And I will take questions.
Okay, next to IU's Kirk White.
Hey, thanks, Chuck. This week, things continued along our planning and preparation for reopening, to include a couple of town hall sessions that were very well attended online by many of our faculty, staff, and students. Thousands, in fact, logged on to listen to the planning and how that's progressing and what the expectations will be. I think the big news of the week are the provisions in Indiana University's Community Responsibility Acknowledgement, the CRA. The CRA is a document that outlines the responsibilities that we expect our students, faculty, and staff to abide by before they return to campus. They will log on with their IU log-on credentials, and we'll read the acknowledgement. It's a 3-page document that I'll highlight the points. And at the end, they agree to abide by these guidelines before they come back to campus in preparation for either continuing work or for fall semester. And the main points are that everyone in our university community and our extended community that includes the university to really, in terms of respecting and protecting the community health. These provisions include everyone monitoring their health and taking reasonable precautions to minimize exposure. And we're going to be asking all of our employees, faculty, and staff, students, to take their temperature every day to make sure that they're not sick. This is something that I got used to when I was on active duty a few months ago. The Army issued us thermometers, and we took our temperatures twice a day. We're going to ask people to do that every morning before they come to campus. We're going to ask them to stay home and contact the IU Health portal that we have on the university computing system, the employee portal. If they feel ill, they should notify their supervisor. They should contact IU Health if they're exposed and have a fever of 100.4 or more, if they're exhibiting any other symptoms or have been advised by their healthcare professionals not to report to work. We will expect them to get tested to stop the spread, cooperate with IU and their local and state health departments for contact tracing. If required to self-isolate or are exhibiting symptoms, IU will pay for time off up to 14 days, which will not count against their normal sick time off. We expect our employees and community to follow on-campus requirements of good hygiene, washing their hands regularly, routinely cleaning and sanitizing their own workspaces, and shared equipment. It's a team effort. We're not going to have people running around all the time able to do this. So we're going to ask people to help clean themselves, their own spaces as well. Wear a cloth face covering at all times when you're in areas where physical distancing is not possible outdoors, and at all times when you're indoors, except when you're in a personal office space where you have 6 feet from other employees. We'll be asking people to adhere to the CDC, state, and local authorities' guidance. Next is understanding their risks, continue to work and teach remotely until told otherwise. And as I've mentioned last week, we're still asking our employees who can do their work from a remote location to continue doing so, unless it's essential or required for them to come to campus. So with all that in mind, they'll be signing that acknowledgement. It's our goal really to make wearing face masks and doing these protective protocols not a sign of being weak, that you have to wear a mask. It's a sign of respect and strength for being able to protect you, your fellow students, and employees, and staff and faculty of our university, and helping keep our greater community healthy as well. And finally, I just say that we're excited about in our neighborhood the opening of Kirkwood tonight and this weekend for restaurant owners on the street. We're very supportive of that. We want to support that economy and glad that the city is making those provisions to help those businesses. Thank you very much.
All right, thank you, Kirk. And just a plug, as I've been doing all week on these webinars, fall2020.iu.edu. If you have any questions about the restart, including the restart guide, that's 29 pages of a lot of detail about what Kirk just talked about. I'm going to jump around a bit on the questions here because Mayor Hamilton mentioned in the comments that he had forgotten to mention that outdoor seating. We do have a question about that, so I will get to everybody's question here. But this is a question from Ethan Burks from WFIU, WTIU for Penny Caudill and Mayor Hamilton. Do you have any safety concerns going into this weekend, given that the bars are open and Kirkwood is adding outdoor street seating? And how will the city, county be monitoring the 100-person limit for public gatherings? If a crowd becomes too large, how will that be handled?
Certainly, I worry about any gathering, and the larger it is, the greater the concern becomes, especially if people are not practicing that physical distancing or wearing face coverings. In terms of even downtown and the spacing, there still has to be spacing. There's still requirements for those businesses in terms of how that's done. So that monitoring will still have to occur in order to kind of maintain that 50-75% capacity and limit that. So there is a difference sometimes between what is considered a social gathering and what's considered allowed in, say, a retail store or a retail food establishment. But there definitely will need to be monitoring happening, and some of the businesses will be responsible for a portion of that.
And thank you. I would just add that, which is what Ms. Caudill just said, but it's important to note that allowing the outdoor seating does not change the number allowed for any establishment to have. That is, whatever their 75% or 50% limit is, that limit applies even when they spill out onto the sidewalk. It's the same number limit. So it actually is very helpful. The more you can get people outdoors, that reduces the risk of infection and transmission. So yes, we're concerned. I continue to be concerned, but any of these establishments is subject to oversight and regulatory review by the health department as restaurants or by the alcohol authorities for bars. But I think the important point is actually providing open space reduces the risk because it means a larger number of their people can be outdoors, not indoors. So we'll see if it works well, just kind of from lots of different directions. The merchants have been interested in this, and from a health perspective, I think it's a positive. So let's see how it goes.
Related to that, again, jumping around a tad here, Emily Ernsberger from the HT asks for Penny. Recently, we've talked about restrictions bars and nightclubs have in place for capacity and equipment and materials protection. Are there any other guidelines for places like sports, root cellar, or night moves that have dancing?
You know, Emily, that's a great question. And right now, I am not aware of any additional things. They are still required in terms of the size limits and the capacity, distancing, masks, face coverings, all those kinds of things would still apply. I haven't seen anything that has added specific restrictions.
Okay. This is a question actually that came in on Facebook. Given new COVID rules that counties elsewhere in the nation are instituting, will Monroe County reconsider requiring masks in grocery stores and pharmacies?
Well, certainly we consider everything on an ongoing basis. So everything is kind of on the table at some point in some fashion. We do encourage all businesses, if they're not required to have the face coverings on already, to strongly encourage that, to make those available for patrons so that if somebody comes without one, they can get one easily. And one of the things that we heard from businesses and the health department and the commissioners have kind of came up with, we are making window clings for businesses to use that essentially says no shoes, no shirt, no mask, no service. And those will be available in a few weeks, and people can voluntarily put those up as a means to help encourage people to wear their face covering in their facilities.
Sure.
Okay.
I might just comment on this, really the last question and this question. I think it reminds us that different measures have very different costs to them. For example, if we've had measures that prohibited in-site dining, that was very expensive because it meant huge numbers of businesses just had to shut down, or we had requirements that businesses shut down. That's a very high cost to help protect the health. There's a lot of other things, or a number of other things that could be done that are much, much lower cost that could also be quite important and effective. Masks is one of those. The cost of using a mask is not high in many ways if you think the benefit is significant. And similarly, the cost of reducing for some weeks or some period of time high concentrations of close together individuals in long-lasting indoor settings is not necessarily as high as some of the other things that we face. So as we're looking at the risks in the fall, that's one of the things I hope we can keep talking about and thinking about, I know we will, is measuring what is the cost of a certain step compared to the potential benefit. And some of these are relatively low cost changes or requirements, and certainly encouraging is a good thing too. But both these last questions kind of reflect the importance of thinking about how costly would these changes be. Thanks.
This is a question again from Ethan Burks at WFIU, WTIU for Penny. Some parts of the county have seen an increase in suicide rates since the pandemic began. Does Monroe County have any data on that, and has there been an increase?
Good question, Ethan. And I certainly don't have any of that accessible to me at the moment, so I can't answer that directly. But I will tell you that anecdotally, we have heard those same things. And I think you've probably have heard Dr. Sharp say before, as we look at the restrictions we've had and moving forward, it is a delicate balancing act. And, it's not just disease prevention or economy, but it is physical health and mental health. All of those things are a huge part of this. We've seen a decrease in our immunization rates. So we know that from our mental health providers that people are struggling. They struggle when they're forced to be inside. And, we talk about social distancing, but it really is physical distancing. But people, when they are isolated, it's very, very difficult. And when you are managing substance abuse or other mental health issues, that just makes that even more difficult. And so I completely expect that, yes, we would say that there have been probably more suicide attempts, perhaps more death by suicide. I don't have those exact numbers, but I can tell you it is a concern, and it is a factor as we consider, do we stay and keep things more restricted, or do we open up? And it is a delicate balancing act.
This one for Brian Shockney. Are the hospitals still doing surge drills to prepare for the possibility of an increase in COVID-19 patients as the county reopens?
Thank you for the question. And yes, we are. We continue to do these. We also have added what we call tabletop exercises. So these are where we set scenarios in individual areas. And as we go through our recovery teams, we do what if exercises with that particular department or that particular area. But then we also are doing statewide drills as IU Health as well. Just yesterday, I toured the ED. Several of us toured the ED just to look at how are we operating as our numbers continue to increase, and how do we flex on an hour-by-hour basis. Some hours are busier than others to ensure that patients are safe. We've still got our negative pressure. We've got line of sight, all of those things. So we're continuously doing that, and we'll continuously to do that as well. The other thing I'll mention is that as we look at prevention in our community, IU Health, as if there are any events going forward that we sponsor either financially or participate and put our brand on, we will expect that all of the things that we've talked about are carried out. And if they're not, we will not be able to sponsor that event, nor will we be able to participate in that event going forward. So we're going to, as I said, the fight is not over, the battle's not over, this continues, and we need to be sure that we demonstrate and role model the things that we need to do to keep our communities safe.
Okay. Allison Moore, by the way, notes that the blood drive dates are June 23rd and 30th and July 17th at the Monroe County Convention Center. Shifting away slightly here, this is a question from Dave Askins at the B Square Beacon for Mayor Hamilton. As you probably heard, the two repeated specific requests that were made at last night's City Council committee meeting on policing police were to, one, sell the Bearcat, and two, reopen the Joseph Smedley case. First of all, can you confirm that you have the power as the city executive to make those things happen? And second, would you consider doing either of them?
Happy to talk about that a bit. I know that's a little off the COVID topic. The short answers are we will continue to review all public safety, including policing protocols, equipment, training, et cetera. And that's been going on in earnest, and happy to continue that review. In the individual case that's referenced, I am aware that there are folks that is a case of a few years ago that was investigated and determined to be a suicide. There are those who want that reviewed, and we welcome any case, including that one, any new data or new information that people have. We welcome that, and we'll continue to look at that. I see the follow-up question just to handle that too. I fully expect that in the budget hearings and the public hearings that we have going forward, there's a lot of debate about public safety, the right approaches. It's obviously been a very important topic for years, and it's a particularly momentous topic right now, given some of the history that we've seen around the country, the importance of rooting out and eliminating racism in all its vestiges. And we'll continue to review all kinds of policies that we have. The Bloomington Police Department's been implementing a lot of those policies that are being discussed and not implemented in a lot of places around the country, but everything's on the table to talk about and how we keep improving in Bloomington.
Okay. Thank you, Mayor Hamilton. I don't see any other questions. Believe that we've hit on all of those. I will do as usual and vamp for a second here if there's any last question, if anyone has that. Penny, you have something you want to add in?
Well, I do. I think I saw one from the mayor about the Fairbanks study, and they haven't released, obviously, all of that information yet. So I don't have a lot of details. I can tell you what I have. So they did 3,600 tests, and that was a little bit of a reduction from phase one, but it did include some vulnerable populations. And I mentioned the 43% who tested positive did not have symptoms. The preliminary results were fewer active cases and perhaps more people with antibodies. And in wave one, there was 1.7% active cases. In wave two, it was 0.6%. And in terms of the antibody rate, it was 1.1% in active cases and 1.5% in antibody rates. So I don't have a lot of details about any of that. That's just what's been provided so far. So it does look like the infection rate is slowing some. That's good, but slowing does not mean it's eliminated, that it's, I think several people have said this, this isn't a time to let down our guard. It's a time to stay the course and kind of stay at it so that it doesn't change and get out of hand. We want to avoid any kind of big surges. We don't want our hospitals to be outside of their capacity, and we want to be able to maintain the health of our citizens and keep them safe. And along with that, we were talking about this weekend, and I believe this weekend also starts Taste to Go. So just kind of a plug for that. They couldn't do Taste of Bloomington this year, and so they've taken on a different format. So that reminded me of that. I just thought I would mention it.
Thanks much. I appreciate it.
Okay. Well, that should do it for this week. We will return again next week, same time. We'll send out all the link information for next week's 1:15 news conference, again, dealing with these COVID issues. Thanks, everybody, for your time.
Thank you,
Thank you,
Chuck.
Chuck, for your help. Appreciate you.
Thank you. Be well.